A national nursing shortage. Many hospitals, including some on our First Coast, are relying now on travel nurses again to get that job done. But as On Your Side's Kaylee Tracy reports, that does come with a cost.
We're actually seeing an increase in the number of our own team members who are calling off absence. So that's it's adding to our burden already, the challenges we're already facing.
Michael D. Schernick, president and CEO of Southeast Georgia Health Systems, says 2 weeks ago only a handful of his employees had COVID. Today, that number is close to 40.
40 represents about 1.5% of our staff. But I think the thing that concerns us the most is the precipitous increase from a handful to 40 really over a short period of time. And so we really need to keep close watch on this.
He says they've had to hire traveling nurses who helped during other COVID surges to cover shifts. Schernick says agencies usually charge $80 per hour for each nurse. Now that price has doubled, he says.
Clearly, it's an untenable position to be placed in. Ultimately, we're not going to be able to continue paying rates like that.
Traveling nurses now make up 35% of his staff. He says they're looking into federal and state funding to help pay for the traveling nurses.
It's something, as I said, really is untenable to be able to continue to pay something like that. And we try our best to make sure that our own staff, the people who have been committed to us over the long term, we try to make sure that we're able to grant them salary increases.
As far as his own staff, Schernick says they're relying on the new CDC guidance letting people go back to work after 5 days of isolation if they're asymptomatic.
That's something, frankly, we're going to count on. We need to have that because we do need to have the staff come back and, frankly, need to make sure that people, as they do carry that 5-day time horizon, that we're able to bring them back to be able to help deal with whatever the demands for services are over the upcoming several weeks.
Kaylee Tracy, First Coast News, On Your Side.